So welcome back to the Future Cities podcast. I'm your host, Stephen Elser. This month we have a very special episode featuring two leaders from the CannonDesign firm. We'll be talking about very important and familiar features found in just about any city, hospitals. Hospitals are such vital parts of the cities where we live, playing a major role in providing health care to a considerable amount of the population. They can also serve as hubs of community and economic development, with some hospitals even working to provide affordable housing and promoting workforce development in the communities that they serve. It's essential that hospitals continue to operate and provide their services during extreme weather events, but this can be a challenge. Our guests today, though, work on this very topic of designing hospitals to be more resilient to extreme events, and will be sharing some insights from a report they've published about some of their previous work. Without further ado, I'm joined today by Mike Kavanaugh, Director of Sustainability, and Brett Farbstein, Director of Resiliency from CannonDesign. Welcome, and thank you for joining us.
Thank you. Thanks for having us.
So before we get into the conversation, I'd just like to give our listeners a chance to get to know both of you and your voices. So could you tell us a little bit about yourselves?
Yeah, thanks, Stephen. So my name is Mike Kavanaugh. I'm the Director of Sustainability at CannonDesign. And my background is I'm an architect, trained as an architect, and I've been practicing for almost 20 years. My interest in sustainability started probably, like a lot of people, around 2007, 2008. As the topic really started to come to the fore of our consciousness. My intro to sustainable design and then resilient design really comes from, as an architect, being aware of design energy and the role it plays in terms of operations of buildings. CannonDesign is a signatory to the AIA 2030 commitment, which is basically a net zero kind of goal-setting commitment that was started by Architecture 2030, and we've been a signatory since 2009. And what it means to be a signatory is that we've been, reporting our design energy since then. And our design energy is the energy use intensity of the buildings that we design. So as that was a major part of our firm's motivation. That was kind of my intro to sustainability. Over the last few years, I've taken on a larger role in the firm, and as we do other areas such as, material health, human impacts, environmental impacts of materials, and also resilient design.
I'm Brett Farbstein. I am the commissioning services leader and resilient design leader for CannonDesign. I am an engineer, but have some architectural background as well. I've gotten involved in the high performance building, sustainability, energy efficiency type of work, and got first involved with resiliency working on the VA Medical Center in New Orleans post-Katrina, and then with projects down in New York City post Superstorm Sandy. Working now with CannonDesign to kind of champion the idea of having resilient design conversations on all our projects. But certainly healthcare have some specific needs that I think is important to have these conversations.
Yeah, absolutely. For those listeners at home, could you explain what is CannonDesign?
Yeah, so as you probably heard, I'm an architect, Brett's an engineer, so that's kind of typifies CannonDesign. We're a multidisciplined architecture and engineering firm. We also have construction services as well. So we're really kind of an integrated design services firm is what we call it. We've got 20 offices. We're international. And our mission as a firm is to create design solutions to the greatest challenges facing our clients and society. That's our mission statement. And so, the challenges of climate change, the challenges of resilient design and sustainable design are very much in line with our firm's mission. And so that's what we focus on professionally, and we're trying to get our industry to focus on that as well.
And what made both of you interested in these positions that you now have in CannonDesign?
So I would say resiliency lends itself to looking to the future, designing for potentials and really extreme events. So for me, it's very exciting as a designer that we're contemplating these events and how we can help mitigate and recover from. So I think it's exciting, and truly, I think they are some of the greatest challenges our clients and our communities and our world faces are the effects of climate change and how if we can't prevent them, how do we deal with them?
Yeah, and I would add to that too that both of us are also dads, and so we each have kids, and that's a major motivation for me. And so it's not just about what we can get our clients to do, but also what we're doing for the future generations that are going to inhabit this planet. And as we see climate change happening, and we see the reports from the IPCC getting more dire, we know there's a business case to make, and we just really need to, we feel like the timing is getting better for this business case because serious businesses are taking this seriously, and healthcare businesses in particular are taking this seriously and even more serious.
Yeah, that's I think a really good point you're making, and I think hearing that anyway is a bit reassuring to me, given certain political actors at the moment cast doubt on the impacts of climate change or whether climate change is even happening. And so to me it's motivating to hear that private entities like CannonDesign are taking this so seriously, and I really appreciate hearing your personal motivations for why this type of work is so important. So thank you for sharing about that. So we've already used the term resilience and resiliency a couple of times through the conversation, and in previous episodes, we've sort of dived into what that term means. But in my own work and in conversations with colleagues that I have, it's pretty clear that the term resilience can mean a lot of things to different people depending on the context. So could you just elaborate on what resilience means for CannonDesign?
So for CannonDesign, we try to keep it pretty simple, and what we say it's preparing for, being able to withstand, and being able to recover from disturbances. And we use disturbances specifically as opposed to a hurricane or a specific event, because it really is a disturbance to your operations or what you expected, your plan of what you would be doing in that facility.
Yeah, that makes sense. And I think using this broader term is useful, but then when you're designing for resilience at these hospitals, you are thinking about specific events that those hospitals are likely to experience, and ways that you can specifically make those hospitals better adapted to those types of extremes. Is that fair to say?
Absolutely. So part of the project would certainly be an assessment and a planning phase where we are evaluating the vulnerability of the site based on the specific potential disasters or disturbances that could affect, weather-related, as well as man-made events, and then comparing that with the functionality and needs of the building, really tailoring a resilient design approach.
Moving on to the main conversation today, and we've alluded to health services, and I mentioned hospitals in the beginning, but our conversation today is predominantly about resilient hospitals. So could you speak on why this particular issue is so important, and what it means in your eyes for a hospital to be resilient?
Yeah, I'll take this one. This is Mike. As Brett mentioned, resiliency is all about, adapting to disturbances, and disturbances could mean different things to different people and different businesses. For a factory that makes widgets, it could be, operational continuity or operational discontinuity. That means that they have to shut down the plant for 8 hours. For a hospital, though, it's you've got critical care patients that are basically in need of all the things that it takes to run a hospital building: electricity, heating, cooling, fresh water, fresh air, and any disruption to those things is going to have a major impact not only on the level of care that those patients are getting, or the level of care that their families are getting while they're there, but also it's a potential liability if any of those services are lost. And also you've got staff that need to be there, so they need to be taken care of as well. So there's a lot of different pieces moving when it comes to a hospital. You can't just send people home for the day if the building's not working the way it's supposed to be. So it needs to be really durable and able to withstand these disturbances.
what would you say then, given those disturbances that hospitals could potentially face, what would make a hospital resilient in your eyes?
That really comes down to location, for one, because a hospital in Florida will be faced with different types of disturbances than a hospital in New England, and certainly different than something in St. Louis or in California. So when we identify these disturbances, we can tailor the mitigation strategies, but the idea is that you're staying operational and you're meeting those different needs. And that may be, you may be dealing with flooding, maybe dealing with high winds, earthquake, and there's certainly some code-driven design features that go into these projects. But I think as resilient design conversations go, we're looking beyond tables and what is bare minimum to code and looking for more extreme events and how do we deal with things looking out 10, 20, 30 years into the future of what those events might be. So we're really increasing our resilience to future disturbances.
So it sounds like you're really trying to take a proactive approach to dealing with these events rather than reactive.
Exactly. I think resilient design is inherently a proactive approach to being able to maintain your operations, protect your real estate, and maintain life safety in events that we can only predict as opposed to rely on what's happened in the past.
So I'm curious how, when you're designing these infrastructure features, what the role of, I guess, uncertainty is when you're making these designs, because there's only so much that we are able to predict. So I'm curious, just if you could speak about the role of uncertainty and how you deal with uncertain features in your design.
Sure. Yeah, in terms of certainty, like Brett said, it depends on the particular risk assessment for the location that this facility, in this case a hospital, is going to be, right? So we know that in California and the middle coastal area of California specifically is going to be a lot more prone to wildfires, say, than a hospital in New England, on the coast of New England. So design features that go into that have to take into consideration, the fact that the building perimeter needs to be kind of free of unnecessary vegetation. The building facade needs to be a non-combustible material or fire-resistant material. And something that a lot of people don't think about is the fresh air. I mean, for hospitals, indoor air quality is huge, and getting fresh air into a building is huge. And so how do you get fresh air into a building when the air outside is smoky and unbreathable? You have to shut down the ventilation systems, and what kind of system do you put into there to recirculate air and clean air when you can't use outside air? So there are systems out there that do that, but they're not systems that you would put into every single hospital there is, because they're expensive. So likewise in New England, we're looking at more risks of inland flooding because of the increased precipitation brought on by climate change. If it's on the coast, we're looking at sea level rise or storm surge, and so we have to protect against water getting into the first floor of that hospital. So we want to make sure that we don't put any of the critical services on the first floor. Certainly no acute care patient rooms, central sterile operating rooms, those types of things that need to be running all the time. We wouldn't do that if there was any chance that water is going to get into that first floor. And for the first floor that is there, that's maybe not used for those critical functions, maybe we need to plan for that first floor to get wet and be able to dry out. So, do we use terrazzo flooring or tile flooring where normally we might use carpeting or something like that? And it's all about, as Brett said earlier, taking that possible disturbance, planning for it, and designing the building so that the building can react to that disturbance as quickly as possible.
Thanks. That was a great answer. And I think that sort of leads into my next question about so a lot of the infrastructure in the U.S. Is not all that great, which is unfortunate given the affluence of our nation that we have a lot of crumbling infrastructure across the country. And I'm curious what you know about the general state of hospitals in the U.S. and whether you think that they are, for the most part, resilient to extreme weather events, and if not, how easily could they get up to code, so to speak? Is it necessary to build new hospitals entirely, or can they be retrofitted?
So I would say certainly any hospitals built 30 to 40 years ago probably did not consider the extreme events of the future, and probably aren't up to the codes of today. So they may need to have new hospitals built, replacement hospitals, but newer buildings certainly have an opportunity to integrate resilient design strategies when they do renovations. They may be major renovations if we're trying to relocate mechanical equipment or generators off the ground floor, but they might be minor considerations if we're talking about doing work on the site as far as mitigating floods or potential wildfires. I mentioned codes, and eventually building codes do catch up with events. We've done it with hurricanes in the South and FPA and fire ratings, but they're lagging after the events happen. So I would say hospitals that are being built today certainly are much better performing, and owners are much more aware of the potential looking ahead. But code is only going to get you to what the tables say as far as potential events, and not necessarily what the peak events might be 20, 30 years from now.
Gotcha. So codes are not as forward-looking as they perhaps ought to be.
Codes are reactive, right? So codes are implemented based on how things perform after an event. And certainly there is a lag between codes being developed and adopted in different municipalities. So they're always behind. Where, again, as I mentioned, with resilient design, we're trying to be proactive and looking toward and being predictive toward the future.
So I noticed that in your report that you published about this topic, that a lot of it focuses on physical design elements on how to improve resiliency, ranging from the consideration of building materials to redundant power sources to even including natural elements like wetlands where possible. But of course, in the case of hospitals, there's an essential human element to the way that they function. So I'm curious how CannonDesign considers the way in which people interact with those spaces, and how the people within those spaces sort of react to the extreme events for which the hospitals are being designed.
Yeah, so there's a couple parts to that answer. One is, how do people kind of inhabit these spaces that are designed for resilience, and the second part is, how do people react when the I guess the disturbance is upon them? For us, the perfect resilient design would not be visible, and the people that are using the building would have no idea that resilience was kind of baked into the design, right? So I think you mentioned wetlands, and in an area where we have increased precipitation that could lead to inland flooding, obviously we're going to try and get the building up higher than we need to, and get it out of that area that might have some potential flooding. But if it's an existing building that we can actually work with and rehab and bring it up to the standards that it needs to be at, we could be introducing some type of on-site detention for excess water that might be due to runoff or roof runoff. Maybe that has some storage in it, but and in the case of our Nantucket project, there was large stormwater detention basins underneath the parking surface in the parking lot. There was also some wetland type elements in the landscape too, just to kind of help that detention. But for the most part, it should just look like, regular old landscaping. And landscaping has come into the fore in terms of healthcare environments as a place for healing. So they're often referred to as places of respite, a place where a family can take the patient outside of the building, walk them around, maybe a trail that goes around the hospital, has little park bench type settings, maybe some tall grasses for a little bit of privacy. And that's actually part of the a trend toward evidence-based design in terms of creating healing environments for patients. That is, giving patients access to natural light, to natural elements, and so that ties in very well with the better healing environments that we know of, ones that take a lot of these resilient design elements into consideration and make it part of the design. How the patients or the staff or the occupants of the building would react in an event, that really has to do a little bit with the design elements, but it has more to do with the plan that gets put in place, and that's part of the resilient design as well, which is working with the facility to create a plan, almost a disaster plan, and making sure they have one in place, so that signage in the corridors leads people to where they need to go. One thing that we look at a lot in healthcare is, how do you keep the building cool in the summer if it's a hot climate, or warm in the winter if it's a cold climate. And so that could be, additional insulation. But we did talk about earlier the natural ventilation that's required, or the ventilation that's required. So we also try and design operable windows into the building so that they can't crack the windows if the ventilation system does go out.
Thank you. That was a great answer. I hadn't heard about this. How'd you refer to it? The healing environments concept. I thought that was really important, and thank you for sharing that with me. I wouldn't have known about it otherwise. So you've alluded to this sort of already, but I'd like to hear a little bit more about the types of tools that you use in your work for determining what adaptations and strategies would be appropriate for hospitals given their locations.
Sure. There's certainly a lot of online tools for predictions on flooding and storm surge that we take full advantage of. But one of the tools that we like to use in-house, and that I think is very exciting, is when we use computer simulations to really tell us how the building is going to perform during the events, and I'm going to stress perform without power. Mike mentioned how we need to provide cooling, we need to provide heating, we need to provide ventilation. Regardless of where your project is, if it's in New England or Florida and it's dealing with hurricanes or just ice storms, your building will eventually lose power. And how your building performs without power over an extended period of time is a really exciting way that we're using a computer simulation to understand and then be able to design some strategies and work with facilities. So we call that a passive survivability model. And we tend to model this during a peak summer heat wave or a peak cold period during the winter. And then we understand how the building performs, not just as a whole, but in individual spaces. What would be required to keep those buildings not necessarily comfortable, but livable and survivable, and being able then to work with the operations in order to relocate people to different parts of that building over the days so that they can then hopefully last and not have to worry about evacuating the project until they can get power restored.
That's a really interesting tool. It sounds really useful and insightful. Now that we have a better idea of the design framework in which you operate and the tools at your disposal, could you tell us a little bit about the case study examples that your firm has already designed?
Sure. So Nantucket Island is a recent project. It's opened a month or so ago. It is a small hospital on Nantucket Island, which is roughly 30 miles off the coast of Massachusetts, sitting in the North Atlantic. And in my mind, if you had to pick a building to be resilient, you really couldn't pick a piece of real estate more precarious than that one. So we certainly looked at all the design considerations and potentials of hurricanes and high winds and ice storms, and the potential for not being able to refuel or restaff the building because of problems in the ocean and having to ship everything by boat. So that hospital was designed with operable windows. We had mechanical systems above the floodplain. We had redundancy in the services. We had extended fuel systems or fuel supply so that the backup and emergency generator system could run beyond the code required hours. And certainly as the only hospital on that island, it is really seen as a community resource, and we like to say it was designed to be the last building standing on the island.
I have just a follow-up question. You mentioned having these stores of gas in order to keep the hospital running in case of power outages. How long could this hospital continue to function just using those sort of backup sources of energy?
So when we evaluated the project, we know that even if that building, the island itself, the utility grid is under risk of being lost during a major event. So code required the hospital to have 72 hours of fuel oil in order to run the backup generator. And in this case, we included a 96-hour storage capacity.
And I know you also have a project in Miami. Do you want to speak on that?
Yeah, I'll talk a little about the Miami. It's the Mount Sinai Medical Center, and it's in Miami Beach section of Miami. So if you look at the predictions for sea level rise, this is kind of ground zero for sea level rise. This particular site in Biscayne Bay area is actually a little bit higher than the others. So the essential strategy was to move the hospital because it wasn't like they were going to not have a hospital there. There's already a hospital there. We're actually adding a bed tower, but is to plan the hospital to be moved a little higher up in elevation. In addition, all the surface area around it was raised up by 4 feet. All the grounds around it to buy it some extra time from that sea level rise. On that one, the first floor, like I mentioned earlier as an example, was designed really so that these critical elements would not be on the first floor, and that the finishes on the first floor would be able to survive any kind of rain or water getting in there, which we don't anticipate for a while. But still, hospitals have to last for 50 years, 60 years, 70 years. So these are long-term buildings and long-term investments. Another project we completed was a bed tower at Texas in the Texas Medical Centers for Texas Children's Hospital. So Texas Medical Center is a collection of hospitals in Houston, And they were affected pretty heavily in 2005 by Hurricane Allison, or actually, sorry, that was 2001. The area was inundated with about 35 inches of rain in a very short period of time, and a lot of the buildings were adversely affected by the runoff, really just getting everywhere, getting into the buildings, getting into the underground spaces. And it was really had to do with two things. One was the area in the neighborhood was, well, three things. It was in a floodplain, so that was one strike. The second was that there was a vast amount of overpaving, so there was really nowhere for the flood water to go. It was all impermeable surfaces. And thirdly, this is kind of a long-term trend in the area, but because of the impermeability of the surfaces, there is a land subsidence effect occurring. So essentially the land is drying out underneath all these buildings, and the buildings are sinking, which it just exacerbates the low-lying area issue. So a few things that were done to that area were really to focus on getting all that asphalt up, and allowing the water to percolate down to combat the subsidence, and also to help the runoff. So that was kind of a big picture strategy for not just the building that we worked on, for all the buildings in the region, in the neighborhood. And so it was really one of the earlier examples of a kind of I wouldn't say a regional strategy, but it was a multi-organizational, almost entire city strategy toward resilience, with a particular eye toward flood resilience. All the openings are protected toward the garages. There's trench drains at major entries. Areaways are elevated up off of the sidewalk, where normally an areaway is a place where fresh air can be brought down into a basement level air handling unit. You may walk over them all the time in cities like New York and Boston and not even think about what they are, but they're pulling in fresh air into the building. These areaways are all elevated up on curbs. There was a lot of connections between buildings underground, and those were not compartmentalized, so that once one building got compromised with flood water, it just spread out to all the other buildings. And so essentially flood doors were put in, almost like submarine doors were put in between buildings to prevent that from happening, so they could be closed. And I think one of the biggest thing had to do with the maintaining or protecting the electrical service for the buildings. So any switch gears that were located below grade were brought up above grade, and not only above grade, but they were raised up above the 500-year floodplain. So you'll have electrical rooms with basically platforms where the switch gears are. And another really big move was that the Texas Medical Center, all the organizations and institutions basically pitched in to create a 48 megawatt district cogeneration plant. So like some of the smaller hospitals that will have a emergency generator with fuel, this is basically an emergency generator on steroids. It's a cogeneration plant. So while it is using fossil fuels, at least it's capturing the waste heat off of that electricity generation and using that for good in the area.
Hearing that response about Houston makes me think about how the decisions that you guys make as a firm for designing these spaces, how those decisions impact the rest of the community. Since, as you mentioned, these choices that you're making are going to influence the buildings surrounding the hospitals, so it becomes sort of almost a regional decision. So I'm curious, when you're designing these features, how much do you communicate and interact with other members of the community, whether it be private business owners, local governments, community organizations, and things of that nature? Since clearly these design elements don't exist in a vacuum, I'm just sort of curious what you do about those interactions.
So hospitals, being the community resource that they are, they're the ones communicating with the community, the greater community, often. So they're bringing a lot of this information back and forth to us and from us. So we may not necessarily directly be involved with community outreach or getting input from the neighborhood, but we certainly have these conversations with our clients and want to make sure that we are integrated into any regional strategies and emphasize how this new building or this renovated building may fit into their community plans.
Oh, I think there's one more project that I wanted to hear you guys speak about, the one in Manhattan. You have anything to share about that?
So that project was really a post-Sandy replanning. After the VA hospital there was inundated by floodwaters, we were part of the team that reevaluated the site and worked to kind of lay out the groundwork of how that project could be rebuilt and to be more resilient going forward.
So these four projects that you guys have worked on in the sort of hospital healthcare institution sort of framing, are there other resilient hospital projects coming up in the future that you'll be working on?
Yeah, we've got a bunch, and without giving away too many details about what they are, I mean, some of the clients that we're encountering now, even in healthcare, which is traditionally a big user of energy, and they've got a lot of priorities other than sustainability in a lot of cases. But they're asking more and more about, how do we get our building to be, forward thinking in terms of energy usage. So we have clients that are, coming to us with, not just trying to meet energy codes, but exceed energy codes. And anytime we can do that and make a building like a hospital higher performing, it's going to be inherently more resilient. So we're hearing a lot more about that, which is really good. One of our clients in California is Kaiser Permanente, and we've got several different projects with them. But I don't know if you're familiar with them and some of their environmentally minded moves that they've been making, but they've been a huge consumer of solar electricity in terms of buying equity on solar farms and actually installing solar on their own projects. And I think in combination with the energy efficiency that we're seeking, we could at some point have essentially net zero energy hospitals in the not too distant future. And a net zero energy hospital is going to be inherently resilient.
Yeah, Stephen, I would add that my goal is that we have these conversations with all our clients, because as designers, I think it's our obligation to point out what we see as the future and potential impacts to their building. So be it a hospital or any other building, I think we're having resilient design conversations.
Yeah, that's really great to hear that you're sort of bringing this to the table with all of your clients. It's obviously such an important consideration. I think in order to have this proactive, forward-looking approach, you really need to consider resilience and long-term resilience, not just 5-10 years, but further than that. I thought that was great that Mike, you were talking about zero energy hospitals, because it's not something I didn't notice in the report that I looked over from you guys, like mention of solar or other sort of renewable energy sources. So that's really exciting to hear that your clients in California and elsewhere are interested in this. So I think that's a great avenue to be moving forward to continue making hospitals even more resilient. Anything else that you two would like to add to the conversation that I haven't directly asked you about?
Oh, I think we've covered it, Stephen.
Yeah, you have great questions. Thanks for asking them.
Well, I'm happy that they covered things well, and thank you so much for taking your time to be with us and sharing your insight. This is a really interesting conversation. I know I learned a lot, and I'm sure our listeners will as well. So thank you so much for talking with us. I really appreciate it. I'd also like to thank Christopher Whitcomb, also from CannonDesign, who helped coordinate this interview. This episode was made possible by Christopher reaching out to our team expressing the interest in collaborating on an episode. So that was really great. So thank you to Christopher, and thanks to you two again so much for being here. We really appreciate it.
Thank you.
Thank you.
The Future Cities podcast is an outreach effort brought to you by the Urban Resilience to Extremes Sustainability Research Network, or UREX as we usually refer to it. To learn more about UREX, visit www.sustainability.asu.edu/urban resilience. If you have any questions, feedback, or suggestions for future episodes, you can email us at futurecitiespodcast@gmail.com or find us on Twitter at FutureCitiesPod. If you enjoyed the episode, please rate and subscribe to us wherever you get your podcasts. See you next time.